Hello, good morning, dear second year ISP students. Welcome again in another course of Medical English, which is the 7th course. So, before starting our lesson, as usual, we have to remember what we have seen in the previous course. In our last session, we have dealt with the role of the nurse during the work and how a nurse could serve a patient during having his meals or even in their rooms. So today we will go a little bit deeply and see some aspects or techniques that may help you during your work. So the first technique is how to take notes. For taking notes is a process done to record the main parts of seminar, a lecture, a speech, or either a course. The skill of listening with understanding plays a vital role while taking down notes. These notes are later expanded and used for the designed purpose. So, note-taking helps us to gather all the data about any seminar or any lesson, and then when we sit and organize them or prepare them, they may be useful for our work. So here are some useful hints for note-taking. Keep the notes brief. Note only vital information. Make notes using words and phrases. Write in points, which mean a point by point, not a full paragraph or a full essay. Avoid using full sentences, and that may help you to learn more and get your notes easily. So, here is an example about note-taking. A nurse here during a seminar, maybe about sickness or diseases, is noting or taking notes according to what the teacher or the doctor is saying. So here, as we see, we have diet, we have high fiber promotes normal peristalsis. We have also what does the iron absorb? Vitamins, iron, bile salts. So here we take the questions from this side and then the answer we report it or we note it in this side. And later on we organize those ideas and get some benefit notes. Here are also some abbreviations that may help you to take notes. C with a dash, up means with. TX, treatment, DX, diagnosis, and THX, a therapy, SX, surgery, and so on and so forth. So, the next element will be report writing. What is report writing and how can it help us? The giving of the report can be a very useful procedure on many different levels. Obviously, there is the imparting of information between members of the nursing team. But the report also has the potential of serving more subtle purposes such as increasing team bonding, team motivation, engendering of good working practices, and increasing patients' empathy amongst the whole nursing team. It also can serve the purpose of a forum for the interchange of ideas between professional members of the staff. So report writing may help the team members or the staff members to exchange ideas easily. So, here is the structure of a report or a report writing. Terms of reference shows us the details of assignment and purpose and scope the investigation of the research. The second is the procedure, indicates the method or the method uses for collecting information. 3. Finding, the process of gathering all the data. Recommendation then is the analysis of the collected data. Signature, place and date. Finally, where and when the report is done. Here we have an example about a simple report. So we put the name here and the age, the address of the patient. We have also the date at the time of the accident, of course of the patient, description of how the accident has occurred, safety precautions, condition of the patient before and after the accident, doctor's examination and findings, treatments ordered by the doctor, witness to accidents, and we have the signature of the doctor and of the nurse, the unit and the date of report. So by following these points, you will be able to produce a very good report that may help other team members or other nurses during work. So while leaving your work or going home after finishing, the report may be in another hands and they will get benefited from it. So, here nurses provided information about pain. An injury is a damage to your body. It is a general term that refers to harm caused by accidents, falls, hits, and weapons, and more. In the United States, millions of people injure themselves every year or either in the world. These injuries range from minor to life-threatening injuries, so the injuries range here differ from the threatening degree. Injuries can happen at work, or play indoors or outdoors, driving a car or walking across the street. Wounds are injuries that break the skin or the body tissues. They include cuts, scrapes, scratches, and punctured skin. They often happen because of an accident, but surgery, sutures, and stitches also cause wounds. Minor wounds usually aren't serious, but it is important to clean them. Serious and infected wounds may require first aid, followed by a visit to your doctor. You should also seek attention if the wound is deep. You cannot close it yourself. You cannot stop the bleeding or get the dirt out, or it does not heal. So here we have two types of injuries. We have injuries and we have wound. And later on, we will see the difference between the two. We have also other common types of injuries, including animal bites, bruises, burns, and electrical injuries, and fractures. So, for more inclusive definition of a wound, it would be that a body surface is breached, such as skin, mucosa, cornea. So, the wound is when the skin or the out of our body is touched. So, it is on the surfaces, rather than the injury could be deeper than we imagine. A wound does not have to be caused by an injury. External force, it can be the result of inflammation, infection, ischemia. Wound may be recorded for follow-up and observing progress of healing with different techniques, which include photographs, X-rays, wound tracing, and counting wound gauge. So the difference here between the injury and the wound is that every wound is an injury, while not is necessary to an injury to be a wound. Moving now to the disease. What is a disease? A disease is a particular abnormal condition that negatively affects the structure function of all of parts of an organism, and that is not due to any immediate external injury. So diseases are not because of external injuries. Diseases are often known to be medical conditions that are associated with specific signs and symptoms. Only some diseases such as influenza are contagious, which means they transmit through contact, and commonly believed infectious. The microorganisms that cause these diseases are known as pathogens and include varieties of bacteria and viruses. Some diseases, such as most, but not all, forms of cancer, heart disease, and mental disorders are non-infectious, which means they don't transmit. Many non-infectious diseases have a partially or completely genetic basis and may thus be transmitted from one generation to another, which means diseases transmit genetically, not by physical contact. The difference between injuries, disease, and illness is that we heal when we got injured. We have a remedy while being ill. So a remedy is having rest and taking some drinks to get rid of ill. We cure while it's a disease. Diseases are chronic while illnesses are for short periods, like from 15 days to 20 days. So we have another technique or another aspect that may help us, and we will see it, which is how to write a cover letter or a recommendation letter. A cover letter is a document that details your qualifications for a particular role. It is an opportunity for you to expand upon your experience and the skills outlined in your resume. A cover letter also allows to express your interest in the position and the reason why you want to apply for this job or the work, the company in the first place. Also, a cover letter allows you to showcase your personality. Oftentimes, a cover letter is the first impression thing that managers will look at. So a good letter or a good cover letter may help us to get the job. So moving to how to write a nursing cover letter. To obtain a nursing position, you will need a clear and concise cover letter that explains what makes you a qualified candidate for the exact or for the real job you are applying for. This includes highlighting your ability or your competences to properly interact with your patients and display a great deal of empathy and support during their time of need. Moving now to the techniques followed to write a good cover letter. First, we have to list our names and contact information. When creating your cover letter, it is important to start by listing your name and address. This can be done in a few different ways, such as, like here we have the example, Jane Doe, and we have the email address, then the address, and the phone number. So here we put all about or all our details. Second, write the date. After listing your name and contact information, make sure to include the date you are planning to send the cover letter. So the date here is following the exact time that you will send the letter. Let's take an example. While we are writing a letter, for example, nowadays or today, then we are deciding to send it after 2 days. We have to put the date after 2 days, not today, which is the date of writing. Place the date, a line after your address and a line above the recipient's name and contact. We will see later how to provide the name and contact of the recipient. So here we have the example. As we have mentioned before, the name, the email address, and the address, the phone number, then comes the date. Third, list the recipient's name and contact information. After including the date, write the recipient's name and contact information. If you don't have either, refer to the company's website or the job posting itself. The section should now look like the following. So here we have our information, then the date, and then the recipient's information, which are the address and the name of the company. 4. Start with the standard professional greeting. If you are writing an email cover letter, begin with this step. Your cover letter should include a professional greeting, of course, such as dear or hello. So it will be a good start for our letter. 5. Write an opening paragraph. As you write your opening paragraph, be sure to include the title of the position you are applying for. This can be followed up by why you want to apply and your enthusiasm for the job in particular. So you have to write the exact title of the job and then send it to the company. 6. Follow with a paragraph about your background in the nursing industry. So you must give a hint or a background about your nursing history or your nursing working time. After your introductory paragraph, start the body of your cover letter with a paragraph about your background in the nursing industry. This means listing any relevant qualifications as it pertains to this role. Some things you can include are your particular skills or achievement, so they are personal achievements that make you a qualified candidate for the position you are applying for. You should also mention any impacts you have made in previous roles and how they can be carried into the position you are applying for now. The next element is write another paragraph about your key qualifications. For your second paragraph, consider including any anecdotes that showcase your qualification for this role. Expand upon your achievements and skills that make you a qualified candidate. So as we have talked before, you must add some extra qualification or capacities. Write a conclusion. Next, include an ending paragraph where you reiterate why you'd make a good fit for the role. Make sure to express your enthusiasm again and include a call to action. In other words, you could say that you are looking forward to hearing back from them with next steps in the hiring process. So here we have to write a very good conclusion to get a reply from the company. 9. Finally, include a professional sign-off. Finally, conclude your cover letter with a professional signature, such as sincerely followed by your full name. The right language will end your nursing cover letter on a positive note. In writing a very good cover letter, we have 4 or 5 steps. First, you have to add the address and the title as we have mentioned before. Then the introductory paragraph, in which you are saying or talking about yourself. Then you apply for the job in another paragraph. And finally, you write a conclusion to get a reply. And end it with a sign-off or a professional sign-off, as we have mentioned. Moving now to some tips for writing your nursing cover letter, and that may help you to get a good one. Consider the following tips when creating your nursing cover letter. First, research. What is a research? Before you write your cover letter, do some research on the culture of the company you are applying to. So to know more about the company you are going to work with, you have to do a research, of course. Also study the job posting and what the healthcare facility is looking for in particular. So the research here is needed before applying to any job. Be relevant and not talk too much, of course. Make sure that the qualification, skills, experience and achievements you are listing on your cover letter are relevant to a nursing position. So, when you're applying for a nursing position, for example, you are not obliged to talk about your cooking abilities or your sports, so talk only about your nursing capacities. Include soft skills. Thought it easy to forget these skills. Make sure you include soft skills. Along with your typical nursing skills, nurses should have a great variety of soft skills, such as communication skills and general interpersonal skills, since they work with their patients throughout the majority of their day. So the nurse here should be a very good communicator to talk with his patients. And finally, we have to check, of course, for errors. As with any job, it is important that you display good attention to the details by making sure your cover letter is free from any errors. So here, dear students, we have arrived to the end of our lesson. Hope that you enjoyed and get some information. Keep yourself safe till we meet next time.